Welcome to Back to Basics by Dr. Pranshu Mehta. This is the second part of the video of murmurs. So if you've not seen the first video, kindly go and see the first video. The link is given below. So okay, let's understand murmurs. So I'm making these valves, the atrioventricular valves and the semilunar valves. So today we'll read about the murmurs which can be heard because of disease or some abnormality in the AV valve or the aortic and pulmonary valves or the semilunar valves. So first starting with the AV valves, we have the tricuspid valve and we also have the bicuspid valve. The tricuspid is located between the right atria and the right ventricle, and the bicuspid, or also known as the mitral, is located between left atrium and left ventricle. What all things can actually cause a murmur, like when a sound can be produced? So if we talk about the valves, there could be stenosis, there could be regurgitation, and there can be some other factors like presence of septal defects, atrial septal defect or the ventricle septal defect. Then even the prolapse of these valves can cause murmurs. For now, we'll talk about the stenosis and regurgitation. Okay, so in stenosis, there could be stenosis of the AV valves, which is the tricuspid and the mitral, or there could be stenosis in the semilunar valves, which are the aortic and the pulmonary. Similarly, there could be regurgitation as well. So for regurgitation also, the regurgitation can occur in the tricuspid or the mitral valve, that is the atrioventricular valve. See, the TR represents tricuspid regurgitation, MR represents the mitral regurgitation. Okay. Other than these, then even the aortic and the pulmonary valve can have regurgitation. These are the semilunar valves. So these all things can produce sound, which is a murmur. These are the additional sounds. So let's start with the stenosis, that too of the atrioventricular valves. Understand how the sound is actually produced. So considering this as the AV valve between the atria and the ventricle, when the pressure is more in the atria, the valves open. This opening of the valve does not produce any sound normally. Now, when the ventricles contract, the pressure in the ventricles increases, forcing these valves to close back to prevent the backflow. This closing of the AV valve produces sound, which we call as the heart sound. But opening of these valves produces no sound, which is the normal condition. Okay. Now, in cases of stenosis, these leaflets are thickened and rigid. They become thick, their size increases, the bulk is more. Now when these rigid leaflets open, they produce sound instead of no sound. So we'll be able to hear one sound when these valves open, but this is not the murmur, this is just a sound. Now when these leaflets close, again we know that closing already produces a sound, but now when these leaflets close, they produce a sound of much higher intensity. So even the heart sound intensity will be more. Now where is the murmur? The murmur is the added sound which is due to the turbulent blood flow through this stenosed valve. So we know that first we'll hear a sound which will be there because of the opening of these valves. Then we'll be able to hear the murmur. So murmur is preceded by this opening sound which we call as the opening snap. Then we'll be able to hear the murmur because then the blood will flow. Then after the murmur stops, after some time when these valves close, again the heart sound which we hear, the heart sound 1, HS1, that will be of increased intensity. So we'll be able to make out that the intensity of the heart sound 1 is increased. Now, okay, let's just see what we have read till now or what we have understood. Tricuspid stenosis or the mitral stenosis, both will have a few things in common. Like these murmurs are diastolic. So these will be diastolic murmurs. The murmur produced by the stenosis of tricuspid as well as mitral will be a diastolic murmur. Now, how and why, that we'll understand later. For now, that these will be diastolic murmurs. Then this murmur will actually be preceded by an opening snap, which we have already understood. That first the AV valve will open, producing a sound which we will call as the opening snap. And then we'll have the murmur. So this we are talking about the stenosis. Now let's understand how and why these are diastolic. Okay, so we'll correlate ECG with the heart sounds. We have already discussed about heart sound and ECG, the normal thing, in previous video. So if you have not seen that, kindly see that. This is the QRS complex, this is the T wave, this is the P wave, again the QRS complex and the T wave. We know that the ventricles contract during the QRS. So when ventricles will contract, what will happen? The pressure in the ventricle will increase, leading to closing of the AV valves. That is when we get our first heart sound. About this I've already told you in the previous video. In case you haven't seen, kindly see that video so that you understand it further. Okay, then during the relaxation, that is T wave, relaxation of the ventricles, when the pressure falls down and the pressure in the aorta and the pulmonary artery is more, the closing of the semilunar valves takes place, and that is what produces the second heart sound, the HS2. So we know that heart sound 1 is produced during the systole and the heart sound 2 is produced during the relaxation or the diastole. Okay, now let's consider the sounds or the murmurs produced by AV stenosis, that is mitral as well as tricuspid stenosis. When the ventricle relaxes during the T wave, what happens? The pressure in the ventricles falls. When the pressure falls below the pressure of the atrium, then the AV valves open over here and the continuous filling of atria and ventricles takes place. Now when the AV valve will open, in case of stenosed valve, it will produce a sound. So we'll get a sound over here which will be after the second heart sound. This sound is what we call the opening snap. It will not be for a long duration. It will be a very swift sound, like it will be there for a very small period of time. This is what we call the opening snap. Now once the AV valve will open, what will happen? The blood will start flowing from the atrium to the ventricle. Now during this phase, till the P wave, till the atria contracts, the blood is flowing. Initially it will be turbulent and then it will be smoothened out. Like then the flow becomes laminar. Now we'll hear a sound because of the initial turbulent flow through this stenosed part. This sound which we'll hear immediately after the opening snap is the murmur, which is diamond shaped. This is the murmur of the stenosis of either tricuspid or the mitral. So diamond shaped murmur will get, which will be just preceded by an opening snap after the heart sound 2 in cases of AV stenosis. Now as you can see, this is a diastolic murmur. We are hearing this sound in the diastole. Now the ventricles are not contracting, the heart is not in systole. So this is a diastolic murmur. Now again this sound will go off. But then when the atria will contract, when the P wave comes, again the blood will be gushed through this stenosed valve. Again the flow becomes turbulent. Now again we might be able to hear another, or you can say a second murmur. This second murmur we call due to the contraction of the atria. So in cases of stenosis, specifically the tricuspid stenosis, we hear this second murmur. So we can see a opening snap, which is after the heart sound 2, which will be followed by the murmur of the AV stenosis. This murmur is diamond shaped, low frequency murmur. This is in the diastole. Then we might be able to hear a second murmur after some time. This second murmur is due to what? Contraction of the atrium. This is due to the atrial contraction. And mostly this is clearly heard in cases of the tricuspid stenosis. This second murmur we hear very clearly in cases of tricuspid stenosis. However, the other characteristics and features remain same for tricuspid as well as the mitral stenosis. So this is what? A opening snap, a diamond shaped murmur which is of low frequency, and both of them in the diastole after the heart sound 2. This is important, after the heart sound 2, and then in some cases we might be able to hear a second murmur that will correspond to the P wave of the ECG. That will be due to atrial contraction. Okay, now moving ahead, let's just quickly recap what features we have seen of the AV stenosis murmurs. So in common, the murmurs of AV stenosis, that is tricuspid stenosis or the mitral stenosis, I'm writing it over here, the tricuspid stenosis, the features which we'll get is there will be an opening snap, but then the murmur will come. So if somebody asks how will be the murmur will be low pitched, it will be diamond shaped, so not present throughout the diastole. It is just present for a small period of time. It is a diamond shaped murmur, low pitched, which is preceded, before that we are getting an opening snap. So we'll say which is preceded by an opening snap. Now this opening snap and the murmur, both of them which we hear them after the second heart sound. That is very important. So a opening snap after the second heart sound and then followed by a murmur. So after the second heart sound. But one additional thing in tricuspid we might get is the second murmur, that is due to the contraction of the atria, which I have already told you, and rest of the things are same for the mitral stenosis as well as the tricuspid stenosis. Now the question is, how to hear or where to auscultate to hear about these murmurs, the murmurs of tricuspid as well as the mitral stenosis. Okay, so I am drawing here the ribs. This is the first intercostal space, the second, third, fourth, and fifth intercostal spaces. This is where the heart will lie, and these are the AV valves. Okay, this one will be the tricuspid, that one will be the mitral. Now, if these are stenosed, what will happen? The murmur will be heard when the blood flows through these valves, producing turbulence. So the sound is actually due to turbulence of the blood flow. It is due to the turbulence of the blood flow. Now, when the blood will flow from the atrium to the ventricle, because there is sternum in the center, the best sound which will be heard will be here, just lateral to the sternum, below the tricuspid in cases of tricuspid disease, and below the mitral in cases of mitral disease. So these will be the two areas where we should auscultate. Now, what are these areas and how to name that and how to tell about these areas medically? Okay, so this area we call as the tricuspid region for auscultation. Now, where does this region lie? It lies just lateral to the sternum, in the fourth intercostal space. So in the fourth intercostal space, just lateral to the sternum on the left, we have the tricuspid area where we will auscultate for the murmurs of tricuspid valve. In both the cases, whether it is regurgitation or stenosis, both. So this is the important area. This area we call as the tricuspid region. Now, when we auscultate these, we have to auscultate for the stenosis with the bell of the diaphragm, because this is a low frequency murmur. So with the bell of the diaphragm, we'll auscultate. Similarly, for the mitral stenosis, we'll auscultate in this region. This region we call as the mitral region, the M or the mitral region. Now this region is located, if I tell you, just lateral to the mid clavicular line. So if I draw a mid clavicular line, this region will be just lateral to the mid clavicular line in the fifth or the fourth intercostal space. It might be in the fifth and in fourth in some patients. In this region we'll find the mitral region. So here also we have to auscultate with the bell of the stethoscope for the stenosis murmur, for mitral stenosis or the tricuspid stenosis. Okay, now moving on to regurgitation. Now let's first see what produces sound in case of regurgitation. Now, like, how is the murmur produced, how is the sound produced in cases of AV regurgitations? Okay, so I'm making again the AV valve. Now, in normal case, when the AV valve is open, the blood is flowing from the atria to the ventricle. But when the ventricle contracts, what happens is this AV valve closes when the pressure increases in the ventricle. Now, when this AV valve closes, this valve closes so that it can prevent the backflow. Like this valve is actually a one-way valve, so it cannot let the blood go back to the atrium. So it closes, producing a seal so that there is no backflow of this blood from the ventricle to the atria. The blood cannot flow back to the atria. This is the main reason of closing of the AV valve. Now, in cases of regurgitation, these valves are not able to close properly. When they close, there is still some gap between these, and because of this very small gap, the blood still flows to the atria, and that is turbulent because the area of this opening is very small. Now this happens when the ventricle is contracting, means this happens during the systole because the ventricles are in contraction. So this turbulence produces sound which we call as the murmur of the regurgitation of AV valves. Okay, so this is the pathophysiology in case of production of sound of the regurgitation, that is the regurgitation murmur. Now we know that this is happening because of improper closure of the AV valve. So we know that this sound will be there after the heart sound 1. Why? Because the AV valve closes and produces heart sound 1. So when these will close, then only this blood will flow back. So this murmur will be present after the heart sound 1, the first heart sound. Whereas we have seen in case of stenosis, the murmur was there after the second heart sound. Okay, and this will be present at the systole, not at the diastole. So when during the systole the ventricles are contracting, the blood will keep flowing till the time the ventricles are contracting. It means this murmur will be present throughout the time when the ventricles are contracting, means it will be pansystolic. It will be present for complete time in the full systole. Whereas in stenosis, the murmur was not throughout the diastole, it was only for a brief period. Now in this case, we'll have a murmur which will be pansystolic murmur. Okay, now we'll correlate it with the ECG again. We know that when the ventricles contract, we get the first heart sound because of closure of the AV valves. Then when the ventricles relax, we get the second heart sound because of the closure of the semilunar valves. Now, we know that the systole is present from the QRS complex, that is when the ventricles start contracting till the time they start relaxing. So this phase is the systole. Now during this systole, the ventricles are in contraction and the blood keeps flowing and the relaxation starts after this. Okay, so the murmur will be present throughout this systole, that is, it will start after the closure of the AV valve. So after we hear the first heart sound, here we'll hear the first heart sound which will correspond to the QRS complex. Then the second heart sound we get in the relaxation, that is during the T wave. We get the second heart sound here. Now during this whole phase, when the ventricles are contracting, there'll be some leak, or we can say the regurgitation through the AV valves, which have already closed. This regurgitation will be there from the ventricle back to the atrium, which will produce a medium frequency, we can say mid-range frequency sound throughout because of the backflow. Now this is where we'll get the murmur. It is a rectangular like kind of a murmur, a similar kind of frequency throughout. Like in that case we had a diamond shaped in case of stenosis, but in this case we'll have a rectangular shaped pansystolic murmur between the heart sound 1 and between the heart sound 2 throughout the systole, because whenever the ventricles are contracting, the blood leak will be there throughout the contraction of the ventricles. Hence it is a pansystolic murmur and its frequency is mid-range. It is a mid-range frequency murmur. Okay, now we have understood about the murmur, we have read about it, but how will we clinically correlate the murmur when we are examining a patient? How to identify which murmur is which one? Like which is the murmur of tricuspid regurgitation or tricuspid stenosis, or mitral regurgitation or mitral stenosis. Okay, so for stenosis, we will have the murmur which will be there after the second heart sound. As we have seen, it will be after the second heart sound. First we'll hear an opening snap and then we'll hear a murmur which will be there only for a brief period of time. Then there can or cannot be a second murmur in this case. Like we might get a second murmur in case of tricuspid stenosis, or we might not get, in as in cases of the mitral stenosis, plus the area where we'll auscultate, whether the tricuspid region or the mitral region. Then in cases of regurgitation, we will get a murmur which will be there after the first heart sound. So in stenosis we are getting a murmur after the second heart sound. In regurgitation of AV valves we are getting a murmur after the first heart sound. Now this murmur will stay throughout the systole. So the murmur of the stenosis is in the diastole and the murmur of the regurgitation is during the systole. Now during the systole means from first heart sound till the second heart sound. It will be there throughout. Now the key here is to identify heart sounds. The heart sound 1 and 2, the lub and the dub sound. Now why are these sounds important? How will we know which one is the first and which one is the second? We have to correlate it with the pulse. So when do we get a pulse? When do we get the carotid pulse? When our heart contracts, when the ventricles contract, that is the heart is in systole. So during systole, the heart sound which we get is the heart sound 1, which occurs due to closure of AV valves when the ventricles are contracting. So when we auscultate and hear a heart sound which correlates with the pulse, that is heart sound number 1. So if we hear a heart sound and then we hear a murmur just after the first heart sound, it is murmur of the regurgitation. Then if we hear a murmur which is after the second heart sound, then it could be the murmur of the stenosis. Like in this case, murmur after first heart sound, when the pulse is felt, that is first heart sound, and that murmur lasts till the second heart sound is heard, means the murmur stays from the first heart sound till the second heart sound, that is throughout the systole. That murmur will be called as the pansystolic murmur, and that murmur will represent what? That murmur will represent the murmur of the regurgitation of the AV valve. Similarly, the murmur which will be there after the second heart sound and it will be heard with a opening snap which will precede the murmur will represent the murmur of the stenosis of the AV valves. Now we know that for the tricuspid as well as the bicuspid, the mitral valve, we can have the regurgitation or the stenosis like TR or TS, and for mitral also we can have the mitral regurgitation or mitral stenosis. Now the difference for them will be, if we are talking about the stenosis, we'll have to auscultate with the bell of the diaphragm, and these murmurs will be heard after the second heart sound and with a opening snap. And in case of TS, we might also get a secondary murmur. Whereas when we are talking about the regurgitation, the mitral regurgitation or the tricuspid regurgitation, these murmurs are best heard with the diaphragm of the stethoscope, not the bell. And these murmurs will be pansystolic throughout the systole. That is, will be heard after the first heart sound, will last till the second heart sound. So this is all about the murmurs of the AV valves due to the stenosis and regurgitation. We'll be back with another video about the murmurs of aortic as well as pulmonary valves, that is the semilunar valves. Till then, I'll say it's better if you read so that you understand these better. And if you like the video and you understand something, do not forget to follow us on Instagram at the E.N.T surgeons, on Twitter the E.N.T surgeons, as well as on Facebook. Whereas you can share about us to your friends and subscribe to our channel as well on YouTube. If you like this video, do not forget to like, share and subscribe to our channel, and comment if you would like to learn something new, a new topic, or would want us to clear another doubt about anything. This is Dr. Pranshu Mehta. Hope to see you in the next video. Thank you.